Hi everyone, myself Dr. Kirti here. Welcome to Pathodisefer channel. Today we are going to learn about the most important topic in FGT, that is female genital tract. About the recent WHO edition, a molecular update classification. So we are going to see about the types of endometrial carcinoma. So I'm going to compare it with two sister story. That is, a two sister will have a completely different personality, right? So we are going to compare it with it. So this endometrial carcinoma, if you consider, they are the most invasive gynecological tumor, and they usually it can associated with a Lynch syndrome, and the main pathogenesis is due to the DNA MMR. What is this MMR? MMR is nothing but these are a mismatch repair gene. If there is a defect in this, it will result in a breast carcinoma and also associated with ovarian cancer. So if you compare the type 1 and type 2, we'll see the key differential features between these two type of cancer. So if you compare with personality, this type 1 sisters, as I told you, they will be very calm and they occur in very young age, and they have a very good prognosis due to dependency in the hormones. Whereas you compare the type 2, they usually occurs in older age patient, and it will be very aggressive, and they always hormonically independent, and they have a very poor prognosis. So this is the key differential features between type 1 and type 2 endometrial carcinoma. So if you see, the most commonly occurrence tumors are type 1 cancer. Okay, whereas 80% of tumor will be type 1 and remaining 10 to 20% will be type 2. If you consider the type 1, they usually arises from the atypical hyperplasia background, and they always, as I told you, it's a hormonal dependent cancer. So they are estrogen under the estrogen stimulation, and it is very common presentation in younger age group. So they usually don't occur in older age group. They occur in very perimenopausal women. Okay, so and they are associated with the other factors. You keep it like this: a fat woman. So fat and anovulation, A for anovulation, T for tamoxifen. And if you see women, W stands for without progesterone, and O stands for ovarian estrogen tumors, and M stands for menstrual irregularity or late menopause, and A stands for atypical hyperplasia precursor, and N stands for nulliparity. So these are the risk factor mnemonic, a fatty woman for a type 1 endometrial cancer. So if we have to remember the stepwise pathogenesis, as I told you, it's a hormonal dependent one. So there will be a higher excess estrogen stimulation. After the estrogen stimulation, the endometrium will keeps on proliferating. So once the proliferation continues, it results in hyperplasia, and ultimately, eventually, it goes to carcinoma. So this is the key pathogenesis of your type 1 endometrial cancer, if you consider. Okay, so next, moving on to the type 2 endometrial cancer tumor. So they are neither hormonal dependent. Okay, they are like estrogen is not very dependent one, it's an independent tumor, where it usually occurs in the older age groups, that is after your menopause. More than 60 years or 55 years group of age people will comes under this type 2 endometrial cancer. Okay, so they also arises from the atypical hyperplasia background. And what is the key pathogenesis over here in type 2 is basically it arises from the atrophy endometrium, not hyperplasia. I told you they usually occurs in the older age group. So older uterus will tend to undergo atrophy. Okay, after the atrophia, if it goes for the pathogenesis to the tumor, they are categorized under type 2 endometrial cancer. So they usually arises from atrophic endometrium but not hyperplastic endometrium. So for example, it will be always older age people, that is more than 60 years or something, they usually come under this one. Okay, so if you see molecular update, they usually presented with the TP53, which is a guardian of tumor. Okay, guardian of tumor genes. So they are the one which is responsible for the pathogenesis. So next, moving on to the molecular classification, type 1 and type 2, as I told you, type 1 will resemble like endometrioid carcinoma, whereas type 2 will be a kind of a serous carcinoma. So coming to the molecular classification, how they classified into 4 tumors. Basically, if you see, the first one is a pole ultra mutated tumors. What is this pole ultra mutated tumors? If you see, this pole is nothing but the DNA proofreading will fail. So once this DNA proofreading fails, surprisingly, it will result in tumor. But they have very good prognosis. How does it happen? So there will be a recurrent mutation will be happening, and they will be not suppressed by this. That is, a pole is proofreading in exonuclease domain of DNA polymerase. So that is called as pole. So that will result in increased somatic mutation. Once there is increased somatic mutation, then there will be a passenger of mutation, and ultimately it results in higher grade of endometrial tumor with TAL. What is this TAL? Tumor infiltrating lymphocyte will be present. So they usually, this pole related pathogenesis usually present in younger age patient with very excellent prognosis. Okay, so next coming on to the second one, that is MMR deficient endometrial carcinoma. So they usually present as a 40% of tumor. So if you see, these are all, MMR is a mismatch repair gene. Okay, so once that is failed, usually they result in tumor. How does it happen? It can be due to the mutation or epigenetic level, that is a silencing of MMR gene. What are this MMR gene? MLH1, PMS2, MSH2 and MSH6. So these are the 4 genes which will be repairing in the mismatch repair. If there is any mismatch in the DNA gene, so that will result, these are the 4 things which will be correcting all those. So if there is a defect in this 4, okay, ultimately the DNA repair will fail and there will be increased mutation, and finally they will result in tumor which is high grade, where TAL will be present and lymphovascular invasion will be present. So they usually have very moderate prognosis if you see. And the third classification is P53 mutation, that is endometrioid carcinoma. This occurs in 18% of tumor. They are also resulting in MSI. What is MSI? That is microsatellite instability. Once there is a microsatellite instability, it will result in a very poor prognosis of tumor. Okay, and the fourth classification is NOS, that is not otherwise specified, whereas the molecular profile of endometrial carcinoma will be there. 30% of tumor will occur like this. They are very unstable due to the MSI and involving CTNB4, ER and PR will be positive, and finally they will have a very squamous differentiation molecular type, and the prognosis will be intermediate. So in simple terms, these are the 4 updates in molecular updates classification according to the recent WHO. So if you see, the key feature is younger women with estrogen dependent is type 1, whereas older women with TP53 mutation, that will result in type 2. So this is the key feature whatever we have talking about. So if you see this diagram, you can see the myometrium, that is in proliferative endometrium. I told you remember like a type 1 tumor in this scenario. So there is an endometrium, all the layers are there, and there is a proliferation. So due to estrogen stimulation, there can be a mutation of P10, MLH1, KRAS and everything. Okay, so once the endometrium is undergoing a lot of hyperplasia, and ultimately the tumor develops, will be coming under type 1 endometrioid adenocarcinoma. Okay, so this is the pathogenesis of your type 1 tumor. If you come to type 2 tumor, as I told you, it occurs in older individual, that is after 55 or 60, after your menopause. So the endometrium here looks atrophied. As you see in this image, it's atrophic endometrium, where due to the TP53 aneuploidy, and finally there will be a mutation and MMR failure, and everything results in a serous adenocarcinoma, which is type 2 endometrioid adenocarcinoma. So this is the simplified concepts about the molecular classification of endometrioid carcinoma. So I hope so this class will be useful for you. We'll come with the other new topic in the next class. Until then, bye-bye.